recently we received the fund for hospital-based business innovation center. And so, as you know, this is Dr. Cheol Kim, radiologist working for Joseon newspaper. He reported that Korean 425 university revenue is 7.5 billion from technology transfer, whereas Princeton reported 3 times, 142 million. As you know, compare the startup company, number of startup companies, Stanford is 39, MIT 30, Harvard is 146,000 compared Salvation University and the KAIST has less than 1,000 until now. And so the Mayo Clinic has every year 13 startup company was founded. And John Hopkins also 18 startup company were founded. And so the Korean ministry, health minister, proposed this kind of project 6 years ago. Korean research-driven hospital. As you know, in Korea, university hospital very strong in clinical research, however, focus on medical treatment, and so lack of support, R&D, also difficult commercialization of research outcome. Therefore, the hospital should change their system to guarantee research activity. One of top priority, convert research-driven hospitals. And so this goal is to make R&D platform, connect hospital and company institute for AT industrial exploration. And so among 45 medical university hospitals, 10 university hospitals were selected as research-driven hospital. And Korea University, 2 hospitals were selected. Major research areas, metabolic disease, cancer, or IT conversion technology, also the regenerative medicine. And so Korean Health Ministry, Korea Health Industry Development Institute established the Korea Biohealth Innovation Center 3 years ago. Their major function is counseling for idea and commercialization, evaluation, and consulting, and industry and university research center, business networking, also finally investment linking. And this is consulting zone, and idea mining, and commercialization, evaluation, and consulting, and business networking. And this is linking early technology startup fund. And so if you look at this here, this Biohealth Innovation Startup Center included all kind of support. And 2 years ago, from the 10 research-driven hospitals, 63 startup company association was established. All startup companies founded by medical professors. And we had this first meeting 2 years ago, and this is directly book of 51 startups. Also, Seoul City is learning Seoul BioHub 3 years ago. This BioHub also the supporting system for startup. Like journey program, you can see idea to commercialization. We 10 research-driven hospital had a relationship since 5 years ago. This is the Toronto group, medical-related science innovation. And you know the Toronto has many hospitals and the companies, they can get together. And Dr. Lavi Hofstad, he's Jewish. He was working for Yojima Group, and he was scouted by Mass Innovation. And so they have many hospitals, 13 hospitals connected, also many companies, especially one of the very interesting companies, collaborative commercialization of regenerative medicine. Michael May, his PhD and CEO, they have an investment company and patent specialists all together. They can help startup company in Toronto. Michael May started the regenerative medicine network like this in many countries. We research professor from research-driven hospital visited Mars to also the Mars building has a JJ Innovation Center. And so we had some collaboration research between Mars Innovation and KIDI. So Toronto University, as you know, strong activity. This is my sample, my research laboratory, and my company and another company from South Korea, and this is Ontario and Canada group, also the Toronto Dentist group, and also start a company. We had Mass Innovation Kidney Joint Seminar or SIGN. Every year, BioKorea World was held, and so here is the Korean Research-Driven Hospital, or 10 hospitals start a company demonstrated their product. Also, Korea University also had a booth area, and president, vice president attend this meeting. This is booth area Korea University. It is also Brazilian Medical Association president. This is Korean Brazilian also attended this BioKorea. And during BioKorea, Canadian group, Ontario group visited our university hospital. Also, I invited them to Guro Hospital. He is the minister of Ontario province, health minister. We visited also here and Canada several times. We have exchanging program. Last year we visited also Brazil, and so Korea-Brazil Global Healthcare Forum. Scientists, medical professors get together. We visit Albert Einstein, and some Syrian hospital. We also visit Boston, CIMIT. This is Center for Integration Medicine and Innovative Technology. And they have very strong network and consortium. This is a consortium, laboratory, hospital, and investment company. That is why they famous company established. I found some very interesting Dr. Entrepreneur homepage website. Here is many medical doctor story was written, also interviewed. This is the orthopedic surgeon. He's hand surgeon. He developed microscope imaging. And so in Korea also, Macrojet, Dr. Surgeon Son is a frontier. 20 years ago, he established a diagnostic device. There are several companies. This I also established a company, and this is a startup established by medical professor of Korean University. Korean University has medical applied R&D Global Initiative Center. This is main campus. We have College of Medicine or College of Health Science. We have 3 hospitals and totally 3,000 beds. Also, this K-Magic is biomedical convergence R&D complex to lead research, innovation, and commercialization. We have research group and department of technology commercialization. I'm responsible for this department. Korean University has 1,700 professors and 200 professors are interested in this kind of research: virus infections, medical device, precision medicine, smart aging, and big data and AI. We have 30 companies, also medical holding companies, 13 companies. My company, first company, and I encourage professors, and now there is 13 companies founded. And so there are several networking, investment company, and also we are learning SPARK program. This SPARK program was established by Stanford Medicine, and Korea University is only one branch SPARK program in Korea. Recently, the Dr. Sang-won Lee working for Anam Hospital, and he received a 30 million project, Precision Hospital Information System project. He used Cloud HIS, HIS, and then Precision Medicine Analysis Service. This is medical analysis platform. And then he collected clinical data and genomic data and live log data, and then system established finally commercialization. And so nowadays, this year, 10 hospitals involved, and finally it's 46 university hospitals will join this program. This is mobile EMR and electronic prescription. Another big project is KAIST, is Living Future Cancer Diagnosis Treatment. He's working for Hae-Ryong Hospital. He's internal medicine doctor and cancer specialist. He received a 60 million fund for this project. Their project included the genomic test department and clinical trial department and cancer management department. They are learning this. Now they finally, Korea University, Guro Hospital, our hospital, we have 1,000 beds. And so we have 4 departments: medical device and vaccine, and regional medicine. I'm responsible for this department after receiving research fund. And now this is a hospital-based innovation center. That the goal of this project is utilization of infrastructure and capability Guro Hospital for collaborative research between hospital and company. And finally, goal is to establish open platform for hospital collaboration. And so this project included 5 hospitals and 61 startups. Also regional cluster 300 startups. And so research is 63 startups. And this business innovation center running by Health Ministry 200 startups. And Korea University Peace Platform and KAIST 100 hospitals, a lot of hospital network, and so we can make collaboration with the other country. Our Guro Hospital has supported 370 companies for past 3 years regarding patent or preclinical and clinical design. Also, we had clinical trial 550 for 10 years. We also have 12 startup company and investment experience. Also, we have conclusion of agreement with Tube and SUD based in Germany, medical device certification. Also, we have the G-Valley surrounding my hospital. And so recently, the Guro University, Guro Hospital and Guro District Office, Guro Gucheong, has declared ICT-based smart healthcare, because Korea Guro Hospital and Guro Gucheong has surrounding area. You can see Korean testing laboratory and a lot of the institute, especially Smart Health Care Association. Also, G-Valley has 10,000 IT and BTM medical device company. And so Guro Hospital is 7 startup company. This project, we have several market support. Also, we have laboratory. Also, our hospital has good infrastructure, including clinical center, or wet lab and dry lab. Our plan is to match the company with clinician and joint research. Recently, 6 joint research forum was established, including VR and big data, rehabilitation device, smart DDS, and skin beauty scalpel. You can see these are 6 research joint forum. This is research passed quickly. This is big data, and this is peace data platform. Finally, we will use blockchain system to pay this kind of service. Skin hair, skin care, scar. We have a total cycle support infrastructure according to TRL phase using our structure. This is bio area and medical information area. And we have also strong infrastructure regarding TIPS and UTech program here, also other investment company. According to stage, ABC, TIPS program also, Korea University has also TIPS program. We are learning. You can see here, and 3 companies had the TIPS program, and we had 2 months ago, we had a project meeting together. Finally, this is John Hopkins' homepage. There is a handle director of advanced academic program, and commercialization is no longer dirty word. Thank you for attention.
짧은 시간에 방대한 양을 소화해 주신 송혜령 교수님께 다시 한번 박수 한번 드립니다. 저희가 점심시간 바로 시작해야 될 것 같은데, 그래도 혹시 질문 있으면 한 가지만 송 교수님이나 대니얼 김 박사님한테 질문하실 분 있으시면 한 분 질문 받도록 하겠습니다. 혹시. 예, 저쪽에 질문.
네, 발표 잘 들었습니다. 송 박사님한테 질문을 드리고요. 지금 마지막에 그 발표자를 보니까 블록체인 서비스가 나오던데 지금 어떤 프로젝트를 지금 계획하고 계시는지
지금 고려대학교의 컴퓨터공학과에 그 블록체인 전문가 그 인호 교수가 있습니다. 그래서 결국 이게 다 이제 돈을 어떻게 낼 건가 하는 그런 문제로 가야 되기 때문에 그래서 이제 블록체인 쪽으로 해가지고 시장에 선두주자로 나가자 그런 시스템. 지금 본다면은 고려대학의 그 피스 사업단하고 K-마스터 이게 전부 다 나중에는 한 500개 전체 병원이 이 시스템을 쓰게 될 수밖에 없게 됩니다. 왜냐하면 매년 홈페이지를 레노베이션 하려면은 시간이 많이 걸리지 않습니까? 그래서 지금 결국 이게 한 5년 된 10년 내에는 고려대학 그 아까 이야기한 그 피스 사업단이 전체 포괄이 될 겁니다. 결국 거기서 또 통용되는 화폐가 있어야 되잖아요. 네? 통용되는 화폐가 이제 블록체인으로 들어가야 되는 그런 프로그램이고 그래서 이런 게 성공하면 이제 외국에 수출도 할 수 있고 저희들이 이제 개방의 실험실에서 포커스를 잡는 거는 이게 프로그램만 팔 게 아니고 정말로 웨어러블 디바이스를 만들어서 그 다음에 병원에 안에 있는 메디컬 디바이스 데이터를 인터페이스 해가지고 이 데이터를 다 빅데이터로 만들어야 됩니다. 저희들 사업단은 약보다는 메디컬 디바이스에 포커스를 둬가지고 이 4차 혁명에 맞게끔 해서 그래서 이제 구로구청하고도 하고 있고 시흥시도 지금 이런 프로젝트를 진행하고 오송도 지금 진행을 하고 있는데 병원들이 같이 붙어야 됩니다. 그래서 같이 병원들이 아주 좋은 원리니까 지금 저희들 실험실 오픈되어 있으니까 여기서 같이 조인하고 싶은 스타트업 아이디어를 같이 조인해서 같이 또 감사합니다.
네, 감사합니다. 이런 자리가 굉장히 소중한 자리이자 기회인 게 보신 것처럼 송 교수님이나 이제 김 박사님이나 한국이나 미국에서 활동을 굉장히 왕성하게 하고 계시기 때문에 많이 인사하시고 필요할 때 찾아뵙고 그러면 굉장히 많은 도움을 받으실 수 있을 것 같습니다. 그래서 오늘 이번 세션 여기까지 마치는 걸로 하고요. 혹시 질문이 있으신 분들은 옆에 계시니까 식사하실 때 오셔서 말씀해 주시고 같이 좋은 시간 나누시면 감사하겠습니다. 감사합니다.